Imagine being born in a poor village in a third world country with a disfiguring deformity. Now imagine trying to be the parent of one of those children in a poor country where you have no money and you know that you have no way to help them and they're going to face a life of ridicule and disadvantage. Either way, you know that the future is not going to be bright for your child. I'm Jenny Adler, and this is speech number 2 for the class Speech 103 with Professor Uhos at National University. I decided on the Fresh Start Surgical Gifts program because it's an organization that I volunteered for in the past. They do important work to help disadvantaged children from the United States and other countries. So I just wanted to give everyone a little bit more information about them. Now, I work as a surgical technologist, so when I decide to volunteer for them, I'm basically just doing what I do for work, but I'm doing it for free. So it's an easy and nice way to give back to the community. Fresh Start Surgical Gifts is an organization that provides needed surgery to infants, children, and teens who are disfigured by either birth defects, accidents, abuse, or disease. It could be anything. It doesn't really matter why. It just matters that they're being helped. It consists of a rotating group of surgeons and other medical professionals who conduct weekend surgical clinics to correct deformities through reconstructive surgery. They also have dental clinics for children who require more complex dental procedures. Fresh Start hosts 6 to 7 surgery weekends per year, and they treat more than 400 children per year. The patients come from Mexico, the United States, Central America, and other countries around the world. The treatments are done at Rady's Children's Hospital in San Diego. Since they began in 1991, Fresh Start has done over $29.9 million worth of free medical surgeries. Fresh Start is able to provide these surgical gifts through donations of money, supplies, and most importantly, people's time. Fresh Start staffs their operating rooms with volunteer surgeons, anesthesiologists, registered nurses, surgical technicians, anesthesia technicians, pre- and post-operative care nurses, and also ancillary volunteers who help with transportation, housing, anything that the child may need or the parents may need, any kind of moral support, just a drink of water, anything. Each surgery weekend will consist of 9 to 12 major surgeries, sessions of speech therapy, consults on new patients, minor treatments, post-operative appointments, all kinds of things. Most Fresh Start patients require many follow-up visits. They usually need years of continuing surgeries to fully correct their deformities. For example, a cleft palate patient on average needs 7 years of post-operative care. Now this may require more surgeries just to correct their lip a little bit, or it could be speech therapy. A lot of times they have dental issues, but still it's 7 years and about 49 treatments for the best possible outcome for these kids. I wanted to tell you all about the majority of the conditions that are treated there. Of course, they treat just about anything, but these are the average ones. They do micro-otia, which is when a child is born with an extremely small ear, either with or without an ear canal, but either way, it's funny looking, so they can be ridiculed for that. A lot of people know what a hemangioma is, just kind of a rubbery growth due to enlarged blood vessels in the face or anywhere else on the body. They treat neurofibromatosis, which is a genetic disorder of the nervous system that results in disfiguring tumors all over the body. They also treat a hairy nevus, which is a giant mole that is often hairy, and it can cover large portions of the child's body. That's what I did last time I volunteered, and I think it was a 1-year-old, and it covered the entire child's trunk, and it was about 1 inch thick and hairy. So obviously it's going to be something that's going to cause them a lot of problems, and it's just something that's good to be able to take care of. Obviously they do cleft lip and palate surgeries. That's a big one. That's probably about 70% of the operations that they do. And that consists of an opening the child is born with in their upper lip and often the roof of the mouth. And it makes it hard for the child to get nutrition, especially as an infant. So that's why it's one of the major conditions that they treat. They treat Treater-Collins syndrome, which affects the bones of the face. It's basically the cheekbones are almost non-existent. They also treat port wine stains, which is a lot of people are familiar with. It's just a deep purple stain on the face or other places on the body, and it's just caused by swollen blood vessels in the skin. They also treat hemifacial microsomia, which is where the lower half of the face is very small and disfigured. I was going to tell you what an average day is like. You show up for work about 6:30 a.m. just like you do in the operating room. You change into surgical scrubs. You get your assignment. You go to your room, collect whatever you need, go over the patient's chart, talk to the doctor, then start the surgery. Then, depending on what it is, you may be out in an hour. You may be out in 5 hours. And the patient goes on to postoperative care. But you're usually there for about 8 to 10 hours a day, so it takes your whole weekend, but for me, it's a good way to kind of give back. Um, just a little bit more about Fresh Start so that everyone knows. It's just an organization to help severely disfigured children from around the world, one child at a time. They do their work in San Diego because Rady Children's Hospital is a great hospital and they have nice operating rooms and great staff. And if they run into any kind of problems, they have the staff of the hospital that they can go to if they need any kind of specialists for extremely complex cases or just other issues. Anyway, I'm glad I could have the chance to give all of you a little more information about Fresh Start Surgical Gifts. Thank you.